Okay, now we have come to a very important diagnosis in urology: prostate cancer. Prostate cancer is one of the absolutely most common cancers in the whole world. It's both incident and prevalent. Prostate cancer is measured mostly and tested for by the test PSA. PSA means prostate-specific antigen, and this is an enzyme that leaks out from the prostate in prostate cancer and also in normal prostates. But it is a very good test and the best test we have up until now. This lecture has the aim of giving you the feeling for PSA so you can act and think according to the level of PSA that you have seen in these patients. I have written a PSA scale here. It starts with number 3, which is the normal level up until 3. That is normal. And then we have a slight increase of PSA when the patient has between 3 and 10. In a patient with a PSA level between 3 and 10, 30% have prostate cancers. That means that 70% do not have prostate cancer, even though it is increased. What do these 70% have? Well, they have, for example, an enlargement of the prostate, benign prostatic hyperplasia. A large prostate produces more PSA than a small prostate. So it's really easy to understand that this can increase the level of PSA slightly. Other differential diagnosis that can cause an increase in PSA is, for example, urinary tract infections and inflammations of the prostate. These irritative diseases to the prostate will cause the prostate to produce PSA. Therefore, they will also have a slight increase. So when you have a patient with a slight increase, you might either look from this side, 70% do not have prostate cancer, or you look at it from this side, 30% have prostate cancer. Here we have to do something. So, how can we make the test better in patients having a slight increase of their PSA? Because this is really where we want to find the prostate cancers in order to cure them from their cancer. We can use, for example, percent-free PSA. This is the level of PSA, the enzyme PSA, that travels around in the blood, in the body, not bound to any proteins. That is the percent-free PSA. It should be as high as possible. The normal level and limit here is 18%. So above 18% is good. We can also correlate the PSA to the size of the prostate. That is called PSA density. The prostate then has to be measured with ultrasound, as we showed in another session, in order to find out the size of the prostate. A very good way of increasing the sensitivity and specificity of the test PSA is to correlate it to the level of increase of PSA in time. That is the PSA velocity. For example, let's say that PSA doubles in 1 year. That is alarming. If the PSA doubles in 10 years, that's really calming down for a urologist. Okay, so now we have some methods of increasing the test's sensitivity and specificity in these slightly increased levels. All cancers are classified according to stage and grade. Stage means the growth of the cancer and the spread of the cancer, the metastasis of the cancer. Grade means aggressiveness of the cancer. Now, let's get back to the PSA level and the PSA scale. Patients having a slight increase of their PSA and a cancer in their prostate usually have a cancer called the T1 cancer. This means that somewhere in this prostate there is a cancer, but you cannot feel it, you cannot see it, you cannot palpate it. It is in there, and it is found only if you take the PSA and biopsies of the prostate. The next stage in prostate cancer is the T2 stage. The patient then usually has a slightly higher level of their PSA, between 10 and 20. Now, the cancer can be palpated, but only within the prostate. So if you palpate a prostate and it's smooth and nice on the surface, but you feel something inside and it happens to be a cancer, then it is a T2 cancer. Usually these patients have between 10 and 20 in their PSA. Above 20, the cancer is usually a little more extensive. Now the cancer usually is within the prostate, but it also have grown through the capsule. This means that this palpation of these patients, they now have a tumor palpable on the surface of the prostate. That's called the T3 prostate cancer. Patients with PSAs over 50 usually have T4 prostate cancer. That means that we have a cancer in the prostate but the definition is that it has grown over on other organs. For example, the rectum. let's make a small rectum here. That is a T4 cancer. And as you can understand now, it's more difficult to cure a patient with a T3 and T4 cancer than a T1 and T2 cancer. Let's get over to metastasis. The risk for metastasis in patients with PSAs between 3 and 10 is almost zero. It's a very low risk for metastasis here. Patients having between 10 and 20 usually do not have prostate metastasis, prostate cancer metastasis, but some really do. So here we start to look for prostate cancer metastasis. Patients having over 20 in their PSA have prostate cancer metastasis to such a rate that we have to really look for it in order to cure these patients. But some patients are negative here and do not have metastasis. Patients with PSA over 50 very often have metastasis and cannot be cured. Now, let's talk about the grade. That was the aggressiveness of a prostate cancer. Aggressiveness of a prostate cancer is usually measured with a method called the Gleason score method. That is a score between 1 and 10. And in order to find out the aggressiveness, the higher the number, the worse aggressiveness of the cancer. So, the grades can be anywhere from slightly aggressive to very aggressive malignancies in all the different PSA levels. So we have to take notice of the grade in these patients.